Paul is a small unitary authority. It's a very beautiful authority. It's surrounded, surrounds the Poole Harbour. It presents as very affluent. But between an area of Sunseeker yachts in sort of second homes for people from the City of London, just behind that little area is an area which came within the worst 10% of health deprivation for older people in the country. And we hadn't previously spotted that.
For our staff working out in the community, they were often frustrated that perhaps they were working from one single organisation, perhaps in quite a, perhaps just in their own sort of professional group, and sometimes their frustration of the care not being joined up, and that's sometimes meaning that an older person ends up in hospital.
Both the Primary Care Trust and Social Services were providing a one-size-fits-all to older people throughout the whole of the borough. And the borough is only 3 miles radius. I can see most of it from my sort of office window. But within that small area, there were pockets of deprivation and pockets of need that weren't being addressed. And historically, like most other local authorities, health were doing their thing, social services were doing their thing, and whilst there was lots of sort of noble sort of joint planning discussions going on at a high level, it wasn't actually coming together at the coalface. So POPs for us led to true integration between health and social services staff at the front line at a locality level.
Just leave that on a second. Yeah.
As well as bringing staff together, health and social care staff, we also appointed a single team leader. And it's been very important to allow that team leader to get on with the job. What wouldn't have worked is if myself from the health service was constantly interfering with that team leader who happened to be working from social services. So that's been very, very important as well, putting that trust, development and encouragement into that team leader.
You're a star.
Partnership working was fundamental from the beginning, with the older people as well, setting up steering groups. You know, it was about going around the local communities, talking to GPs, talking to older people, and actually being very honest with them about what we were trying to do. When you're changing culture and you're changing sort of systems and how things traditionally have been done, and you know, culture normally would eat strategy for breakfast kind of thing. You know, you've got to be able to convince people.
I wondered here.
Whereas we used to have home care assistants and nursing auxiliaries, we now have intermediate care assistants doing health and social care, and that's a mainstream service now.
I guess you better have your medication now then.
We've got really good links with local surgeries, and we can get results and really treat people much quicker than we ever could before. We work very closely with social workers and nurses. The networking is brilliant, and I can get answers to any queries very, very quickly, which I could never do before.
Prior to coming into hospital this time, you were having carers.
Yes,
Was that all working okay?
I'm working very closely with social workers, and we've got access to carers. We're an integrated team, and we've got access to all sorts of services such as assistive technology, hot meal delivery services, all sorts of things that are available.
You don't like to be too early in the morning,
no.
do you? No.
We can have access to services straight away, whereas before I'd have to make referrals by fax or phone, paperwork, and now I can do it directly because we're within a team working together, and I can arrange things myself without having to wait for other people to do it and that sort of thing. It's definitely preventing people from going in hospital, whereas before they might have gone in, now we're looking after them at home. Also, when they do go in hospital, we're able to quickly facilitate them going back home and promoting their independence and getting them back on their feet again, which is a priority and much better quality of life for people.
I think it is very important to build and develop relationships, good working relationships between organisations, and I know that's sometimes easier said than done, but I think you have to keep working on that. I think you have to develop a level of trust to be able to try things together, to take risks together across organisations, and not to be critical or blaming if things don't work first time round, to be prepared to learn and improve.
We're not precious about the professional boundaries, and that's one of the real other lessons that's come out of POPs, is that when you have staff who have a clear focus on targets, a clear affinity with the locality, and also having been interviewed by older people, they view older people as citizens rather than as patients or service users, their commitment is more to about achieving positive change for older people rather than keeping themselves attached to professional boundaries.
Well, we know it's working from the statistics, because we know that in the 2 areas where we have the POPs pilot, that we've achieved a 23% reduction in the occupied bed days for older people going into hospital, and we've achieved over 5% reduction in emergency admission. So that's over and above any other reductions that were made in other areas. So we know it's working from that point of view. But most importantly, our older people themselves are telling us what a difference it's made to them.